As part of the course, you'll be required to complete a minimum of 90 hours in clinical practice under the supervision of a designated prescribing practitioner, or a DPP. The DPP will play a vital role in ensuring that you become a competent and confident prescriber. So in this short video, I'll explain the DPP role and give you some advice on how to make sure that you secure the right DPP for you. If you are registered with the HCPC or GPHC, then you will need one DPP, and that DPP will be responsible for your supervision and assessment. If you're a nurse or midwife, you will need two DPPs, a practice supervisor and a practice assessor, and these two have very different roles and responsibilities. Your supervisor, the time you spend with your supervisor is where you are going to learn. So they are responsible for teaching you everything you need to know about prescribing within your area of practice. You're going to spend the majority of your time with this person. So we stipulate that you should spend a minimum of 45 hours with your practice supervisor. Your practice assessor is responsible for determining whether you have reached the right level of competence to pass the course. So you will spend less time with your practice assessor. So we stipulate a minimum of 10 hours. And because they're not responsible for teaching you, then the area of their practice is less important. They don't have to work in the same area that you do. So to give you an example, if you were a diabetes specialist nurse, your ideal practice supervisor would be a diabetes specialist nurse that is a prescriber, and maybe your practice assessor would be your consultant. Or if you're a trainee advanced clinical practitioner working in primary care, then your ideal practice supervisor would be another ACP who is a prescriber working within primary care, and maybe a GP would perform the role of assessor. If you need one DPP, then the qualities you need to look for really are the same as for a supervisor, because this person will be responsible for teaching you. So if you're a community pharmacist, another suitably qualified prescribing community pharmacist would make a good DPP for you, as they would be continually seeing the same type of presentations as you would be seeing once qualified, and those would tend to be minor illness. A GP, for example, if you were to opt for a GP as a DPP, then significantly less time spent with them would be relevant to you, as their workload does not involve much minor illness presentations. So who can be a DPP? So they need to be an experienced prescriber. And what we mean by experienced is that they've normally been a prescriber for a minimum of 3 years. They need to be an active and patient-facing prescriber. So somebody who is regularly assessing and prescribing for patients. And remember, if it's your practice supervisor, this needs to be somebody who's regularly assessing and prescribing for patients within your area. It can be a doctor, or it can be any independent prescriber. It doesn't have to be the same profession as you, but they do have to hold a full independent prescribing qualification. And they also must meet the criteria of the Royal Pharmaceutical Society DPP framework. And if you scan that QR code, it'll take you to that framework. So the right DPP will provide you with sufficient exposure to prescribing consultations relevant to your scope of practice. And also you need to ask yourself, will they challenge you? Will they ask you questions and encourage a discussion with you? Are they going to take an active role in your education? Because that's the kind of DPP that you want. And just to note that normally we would not allow a DPP to perform the role for more than one trainee prescriber at a time, because it's really important for us that your DPP can fully commit their time to you. If you have any questions about the DPP role, then do please get in touch with me. But remember, it's really important to take your time to consider who is best placed to perform the DPP role or roles for you.